We don't know if this is the prelude to getting worse or if it's just a blip. So we're in the dark yet again with COVID, unfortunately. So we're starting to see an increase again. We actually don't have a very good handle on the numbers right now. Most people are now testing at home, in private, and those cases are not reported. Hospitals in 40 states have now reported an increase in COVID cases. We think a number of them are somewhat less serious than we were seeing, say, with Delta late last year. But any increase obviously is not good. And it also suggests that there's a tremendous rise in cases that's being reflected maybe a little bit later in hospitalizations. We haven't yet seen an increase in deaths, which is great. I think that's a combination of the people who are getting infected now. Many of them have been infected before or have been vaccinated, so they're a little less vulnerable, hopefully. And also our treatments are getting better. So the risk of death seems to be coming down, but still the risk of infection is still very, very high. What it is this BA.5 variant. It's not clear whether it's more transmissible or just that it's different enough that people aren't protected from previous infections or vaccinations, so that's why it's taking off. But it's now the dominant strain in the US. Something like 3/4 of Americans have had at least one vaccine. The issue is that with Omicron, as opposed to the previous variants, you really seem to need 3 shots to get good protection from the vaccine. The White House has suggested that anybody over 50 who hasn't had a vaccine this year get a booster this year at this point. Other people I've talked to have said that if you're otherwise healthy, it might make sense to wait a few months and get a vaccine in the fall instead, when rates are expected to be even higher. I don't think that there will be mask mandates. It doesn't seem like the public has an appetite for that, but that doesn't mean that people can't choose to wear a mask, especially people who are immune compromised or elderly. The experts I'm talking to are saying they really should be wearing a mask right now in public settings because that's the only way to protect themselves against infection.
Hey, thanks for watching. If you like this video, check out these other videos from USA Today to stay up to date with all the latest news.